Opening credits. Complete Pregnancy Guide. Written by Bill Vincent. Narrated by Dickie Thomas. Complete Pregnancy Guide. Having a Healthy Pregnancy by Bill Vincent. All rights reserved. Introduction. If you suspect or know that you are pregnant, we hope you have already visited your doctor. Presuming that you have confirmed your suspicions and that this is your first child, or that you wish to take better care of yourself during pregnancy than you did during your other pregnancies, you have come to the right place. Our goal is to give you all the information you will need to care for your health and the health of your unborn child during your pregnancy. To do that, we believe it is important for you to understand pregnancy and what is happening to your body as your baby develops and nears term. Therefore, all the information we give you about taking care of yourself will be clarified with information about what is happening to your body and why it is important to follow the recommendations we give you and the recommendations and advice of your doctor. First and foremost, it is important to consult a doctor and to get on a schedule of visits and testing to accommodate every stage of your pregnancy. If you are healthy and expect a normal pregnancy, you have some options for health and care during your pregnancy. 1. Obstetrician/gynecologist, OB/GYN. These doctors have a specialty in pregnancy and women's health. 2. Family general practitioner or internist. Doctors who provide standard medical care to all men and women, and in some cases will provide obstetrical care. Although malpractice insurance for this type of medical care has sharply increased, so in many cases general practitioners, GPs, and internists no longer deliver babies or treat women during the pregnancy term. So many of these doctors will no longer care for a pregnant woman, but instead will refer you to an OB/GYN. 3. Nurse/midwives. These healthcare professionals specialize in women's health and follow a pregnant mother through prenatal care and labor and delivery. Nurse midwives need a doctor on call for the delivery in case there is a problem during delivery. They also provide post-mortem care for normal pregnancies, referring women to an OB/GYN for complications or specific health-related issues. Be sure your midwife is certified and fully trained. When you visit your doctor for the first time, he/she will perform blood tests and a pelvic exam to confirm your pregnancy and estimate a due date. We'll talk a little about due dates later when we discuss the first trimester. The blood test detects HCG, human chorionic gonadotropin. HCG is a hormone produced by a woman's body after an egg has been fertilized and a woman's pregnancy commences. HCG can be detected in blood or urine even before a missed period, as early as 6 to 8 days after conception. HCG levels will significantly increase during the first trimester and then decrease a bit throughout the remainder of the pregnancy. Normal HCG levels can indicate a possible miscarriage or a tubal pregnancy, or it may mean the mother can expect a multiple birth, twins, triplets, etc. Your doctor will talk to you about any abnormality in your HCG levels and monitor these levels throughout your pregnancy. Assuming your HCG levels are consistent with a normal pregnancy, this test will not be performed again. Doctor visits and examinations should also take into consideration your family history and any pre-existing health problems you may have. You should also tell your doctor about any special circumstances you may need to accommodate because of your job or your family situation. During your pregnancy, your doctor may or will perform certain tests, depending on your individual situation. We have included a list of these tests here. You will find a routine doctor's visit schedule included in the list below. Remember that your individual situation may vary, but this list will give you an idea of when and how often you will need to see your doctor and what tests may be performed while you are there. First exam, an HCG test, 6 to 8 weeks into your term, chorionic villus sampling, CVS. 10 to 12 weeks into your term, second doctor's visit. 10 to 12 weeks into your term, amniocentesis. 15 to 18 weeks into your term, third doctor's visit.
Sample complete. Ready to continue?